So hi everyone, my name is Dr. Teresa Swist. I'm a research fellow at the Institute for Culture and Society. And the particular focus I would like to share with you today is this idea of looking closely at the interrelationship between platforms, people and places. And this idea of a networked capability approach has been developed with my colleague, Associate Professor Pip Collin. And I believe it connects strongly to Hinchliffe and colleagues' notion of healthy publics, as it invites us to look at the complexity and power relations of not just the social aspects of health, but also the settings, environments, geographies, and in particular the significant role new technologies or platforms are playing. And this area of existing and emerging technologies will be a particular focus of mine in coming months. So the question I'd like to propose and attempt to answer in the short time I have is the following. So how can we enhance young people's agency and wellbeing in health research and healthy publics? So Research Stream 1 of the Wellbeing, Health and Youth CRE is particularly interested in this question as we are exploring an ethics of engagement. And there is significant concern that narrow biomedical or technocentric approaches to young people's health do not fully address the social, cultural and ecological aspects of health. So it could be, in a way, said to be contributing to unhealthy publics. So in contrast, if we are to better understand young people's engagement in relation to a diversity of platforms, people and places, maybe we can better delve into the opportunities that the concept of healthy publics offers us. So an approach we have been developing and finding useful is called the networked capability approach. Pip Collin and I developed this idea which draws upon Amartya Sen's capability approach and Paparachisi's concept of the networked self. We found it useful to blend these aspects together to foreground the role that the digital, social and spatial intermediaries play in both enabling and constraining young people's agency and well-being. So if we like this concept of healthy publics and we recognise that there is a need to be looking at platforms, people and places, what type of research methods might be useful to examine this interrelationship? So as mentioned by Rachel, the Intergenerate Lab is led by Associate Professor Amanda Third and Pip Collin, and we are keen to utilise these methods with the Wellbeing, Health and Youth CRE to draw attention to the digital, the social and the spatial. So these are methods such as co-designing products, platforms and services, co-researching, so developing young people's research skills and literacies so they can be co-researchers and do peer research as well. And also this idea of place-based research, which really sort of focuses on the environment and the geographies, whether they be online or offline. So there are many tensions and opportunities with existing technologies. The rise of digital health, existing biobanks and electronic health records, and health management systems. And these tensions and opportunities are only going to be amplified with new and emerging technologies, such as artificial intelligence and how machine learning is going to be applied to, or is being applied to some biobanks and electronic health records. The rise of the Internet of Things, such as wearables and ingestibles, and also this idea of extended reality, which is a term which covers virtual reality and augmented reality. And also a big player in this field of emerging technologies I think we are all hearing about is the rise of the big four, which is Google, Amazon, Facebook and Apple. And we need to add a fifth one, now Uber. And they're very excited about coming into the health space. And this is raising a lot of issues, as we've been hearing about, in terms of data, privacy and consent. And there's a lot of issues around these new sort of public and private partnerships and who is actually participating and who is actually benefiting. So in closing, I'd like to propose 4 things. Firstly, that we need to play with new novel concepts, such as the idea of healthy publics. Secondly, we need to explore new approaches, such as a networked capability approach, to understand the human and non-human aspects that shape agency and well-being. Thirdly, that we need to utilise diverse methods, such as co-design, co-research and place-based research, to involve young people in health research in a variety of ways, to understand the complexity and the power relations. And fourthly, as highlighted earlier, we've co-created an engagement framework that foregrounds some of the commitments and values that we can take, but also revise as we go on our journey over the course of the Centre of Research Excellence and the development of an Adolescent Health Research Commission, and hopefully beyond, to enhance young people's agency and participation in health research and healthy publics. So I'd like to finish up there, and I think we're going to be moving on to our panel, which Rachel is going to facilitate.